Okay, he start. Hi, lady.
Hello.
Hi, I'm Ibrahim Diallo. I'm the nurse practitioner. I'll be examining you today. So welcome to the clinic. I just wanted to ask you to give me permission to record the video so I can send it to my professor.
Yes.
Great. Thank you. So what we're going to be doing today is your physical examination, right? So first we're going to examine your head. We're going to examine your ears, your eyes, your nose, and your throat. Okay?
Okay.
If you have any question or any concern or you want to get a break, just please let me know. So, are you ready?
Yes.
All right. So, we're going to start your physical examination. First, I am going to, you can sit here, please. Here. So, first, I'm going to, examine your head, right? I'm going to inspect your hair. I'm going to see if there's any lesions, any rash, any swelling, any bulging, right? I'm also gonna feel your hair distribution and the texture, right? And then now I'm gonna palpate your head just to see if I can feel, any depressions, any hematomas, right? Any cysts or any lesions. I do not feel anything so far. Everything is looking good. All right, so the next thing we're going to do is I'm going to examine your eyes. All right, and no, first about your head first. I see your head, the size is normal, right? And the shape is normal, right? And you don't have any rash, you don't have any hematomas, you don't have any swelling, you don't have any cysts, right? And your hair distribution and the texture seems to be normal, right? So the next step we're going to do is we're going to examine your eyes. First, I'm going to check your visual acuity, okay? And I'm going to give you this Snelling chart, right? And I'm going to hold it to 6 feet, and you're going to read the lowest, letter possible on this chart, okay? So what I'm going to do is I'm going to stand up right here, and I'm going to ask you to close your left eye. Can you read the lowest line possible here?
Okay. L T F P H.
Great. Can you do the other one, the right one, the right eye?
L T F P H.
Great. Now uncover both eyes. Can you read with both eyes the lowest letter possible?
L T F P H.
Great. Excellent. So now the next step we're going to do is we're going to do your visual field examination. All right. And we're going to do this by doing a visual confrontation. So what I'm going to do first, I'm going to ask you to cover your left eye. Right? So what I'm going to do is I'm going to look straight at my nose. Actually, hold on 1 second, right? Can you please sit on the bed right here?
Sure.
You're gonna switch the seat. I'm gonna sit right here, and I'm gonna keep at least a length of distance, right? So cover your left eye and look at me straight, right? Do not move your head. Just see my fingers moving, okay? So now, tell me, how many fingers do you see?
2,
How many fingers do you see?
1,
How many fingers do you see?
2,
How many fingers do you see?
1.
Okay, can you switch to the other eye? How many fingers do you see?
1,
How many fingers do you see?
2,
Great. Now uncover both of your eyes. How many fingers do you see?
2,
How many fingers do you see?
2.
Alright, great. So now, please, you can get back to your seat right here. Thank you very much for that. The other thing I'm going to do is I'm going to ask you to open both of your eyes to to open both of your eyes, and when you see my hands, let me know, okay? When you can see my hands.
I see it now.
You can see it now?
Yes. I see it. I see it.
Great. So you're looking at my nose straight, and just move your eyes, or tell me when you feel it, okay?
I see it.
Okay.
I see it.
How many fingers you see?
2,
How many fingers you see?
1,
How many fingers you see?
2.
Great. So now, what I'm going to do on the next step, I am going to, inspect, your eyes. I'm going to inspect your eyebrows. I'm going to inspect your eyelashes. I'm going to, inspect your lacrimal gland apparatus, right? And then I do not see, any rash. I don't see any stye. I don't see any exophthalmos. I do not see any, drooping eyelids, right? And I'm gonna shine, the light through your eyes just to see how your sclera is. Open your eyes wide, please. Okay, it's clear. Let me see this one. This is clear. So now I'm gonna shine the light. Cover this eye, please. Let me just see if, open your eyes. Okay, I see your eye constrict. Okay, take this out. Open your eyes wide. Okay, I see your eyes constricting. And then I'm gonna check this one. I see your eye constricting. And then I see the other eye constricting. So, continuing, I'm gonna pretend like I'm putting some gloves on, right? And then I'm gonna look at your eyes. Open your eyes, look down. I do not see any jaundice, no discoloration. Your sclera is clear, your lenses are clear. Look up. Your lenses are clear. Your lacrimal gland are patent. I do not see any redness. I do not see any, any bulging, any pulsation. What I'm going to do next is I'm going to ask you to to look at straight at my nose, right? I'm gonna shine this light, over you. Oh, first of all, hold on. Before we get to that, I'm gonna, check your extraocular muscles, right? And what you're gonna do is you look at me straight through my nose, and then you follow my finger, but do not move your eyes. Do not move your head. Just move your eyes, okay? So first, you can see my finger.
Yes.
All right, cool. So I'm checking, the rectus, lateral rectus, superior rectus, inferior rectus, back to the middle, left lateral rectus, superior lateral rectus, inferior lateral rectus, back to the middle, and then I'm gonna check, the inferior oblique and the superior oblique. So also I'm going to check for what I did here with the extraocular muscles. I do not see nystagmus, because when I was checking the rectus and the rectus laterally, inferiorly and superiorly, the eye movement was normal. There's no back and forth or wiggling of the eye. So the eye muscles move lateral, inferior and superior normally, right? And then now what I'm going to do is I'm going to check also the, so I'm going to, now what I'm going to do is I'm going to check your pupils constriction, right, and accommodation. constriction means your pupils, when I as I get closer to you, right, you can see the pupils converge and moving toward, the same direction. Let me shine the light. You see? So they converge now. Now look at straight at my finger and look far away. Look far away. Alright, I can see the adaptation and accommodation here, as my finger get closer to her, and about 5 to 15 centimeters, I can see the pupils constrict together, and as she shift the gaze, from close to, far away, to the distant gaze, and I can see the pupils constrict, dilate as well. And your eyes, I see, they're symmetrical, the lining is great. And like I said, I do not see any discharge. I don't see any sty, around your eyes. So the next step that I'm going to do is called the the fundus examination. So what I'm going to do is I'm going to examine your right eye first. Show me your right eye, please. Your right eyes, right? So what you're going to do is you're going to look over my shoulder, right? And then I'm gonna shine this light, over your eye, and as I get closer, I'm gonna say so I can perform the examination inside the eye's internal structures. Okay. So first, I'm gonna shine, your eyes. Look at me straight. Look at me straight, so I can see the red. I can see the red reflex. So what I'm going to do is I'm gonna, follow that red reflex on your right eye. Right, close to you. Open your eyes. So this is great. So when I look inside the eye, I see the sclera is clear, the lenses are clear, right? The iris is clear, and I can see the internal structures. The disc margin is sharp, right? And I can see the maculae, the fovea structures. The veins are actually, bigger than the arteries, and they're more of like a relatively like a darker than the arteries. I see that your arteries are not dilating; they very thin actually, with the light red color, right? So the next step is I'm going to, and I see the red reflex on it as well. So the next step is I'm going to do the same thing for the left eye. Okay, so I'm gonna just look over my shoulder over here, and I'm gonna shine this light into your eye, and as I get closer, okay, great. So the same basic structures, I can see the iris, the lenses, the sclera, looks transparent and clear. And then internally, I can see the veins, I can see the maculae, I can see the fovea, I can see the the cupping, and the disc ratio is about 1/3, and then the cup is not enlarged, right? And the color of the disc is more of like a pinkish orangish kind of, and then it's the margins are very sharp as well. So I do not see any abnormal structure as far as this current examination. So for the eyes, I'm pretty much done with the eyes. Unless I remember something later on, I could get back to it. but the next step is we're going to, examine your nose, right? Same thing like we did for the first one. We're gonna inspect your nose first, right? Make sure there's no redness, there's no discoloration, and the nose is symmetric, it's in the midline, and there's no deformity. And I'm gonna palpate. I put my gloves on. I'm gonna palpate, your maxillary sinuses. Do you feel any tenderness, any pain?
No.
And then I'm gonna palpate your frontal sinuses. You feel any tenderness?
No.
All right, great. So that's great. Now we're gonna get back to the nose. So what I'm gonna do is I'm gonna check for patency first. Can you occlude one nostril? Breathe in. Occlude the other one. Breathe in. Great. So now what I'm gonna do, I'm gonna make you smell, two separate things. You tell me what you smell, okay? You smell?
Yeah, like fresh. The other one fresh.
Deodorant fresh. Okay, thank you. What about this one?
Like perfume, flowers.
Great, thank you. This is great. So that's really good. What I'm going to do next is while I'm talking to you, I'm gonna change, this speculum right here, and then I'm gonna try to examine your inside your nose. Okay? Are you feeling okay so far?
Yes.
Are you enjoying the examination?
Yes.
That's great. I'm happy to hear that. I'm a brand new nurse practitioner, so we're gonna do good work.
Okay.
So what I'm gonna do is I'm gonna examine inside. Just please keep your face up a little bit. I got my gloves on, my hands are washed, and I changed the speculum. So what I'm gonna do is great. It's looking good. Inside the nose, I see that the septum, is in line. There's no deviation. There's no discoloration. There's no perforation on the septum, and I see the lining of the mucosal lining inside your nose is kind of pink, and I do not see any redness or any swelling, and I do not see any polyps inside your nose, right? And I see that you don't have no difficulty breathing in any of the nostrils, right? And I do not see any discharge as well. So that sounds great. So the next thing we're gonna do is we are going to examine your ears, right? So like I said before, first thing we're gonna do with we're gonna check your your auditory acuity first, right? So what I'm gonna do is I'm gonna give you a little test. You're gonna occlude one ear, occlude one ear for me. I'm gonna say one word and you repeat what you heard, okay?
Okay.
Blue, black. Oh, wait. Blue, black. What did you hear?
Blue, black.
Now occlude this one. Blue, black. What did you hear?
Blue, black.
Great, thank you for that. So that's a great job right there. The next thing we're gonna do is I'm going to inspect your left ear, right? And I'm going to look for any keloids, you know what I mean, any injury, any abnormalities, any cyst, or any swelling or any rash, on the outside of the ear. And can you please turn this way a little bit? This way a little bit more, please. So you can see. So I'm gonna inspect the ear, right? I do not see any keloid. I do not see any rash, any discoloration, and no redness, no injury, no scar either. So what I'm gonna do is I'm gonna palpate, the pinna, right? And I'm gonna feel all the way through. I'm gonna touch the tragus right here, and I'm going to pull up and down, right? If you feel any pain, let me know, right? Do you feel any pain?
No.
And then I'm gonna palpate in the back of your ears. Do you feel any tenderness?
No.
Great. That's really good to hear. And I do not see, any I do not see any serum. I do not see any discharge, right? So what I'm going to do next is I'm going to look your your ears. So let me just change the speculum. So basically what I'm going to do is I'm going to insert the speculum inside your ear canal just to observe what's going on in it, okay?
Okay.
So what I'm gonna do is I'm gonna pull back and down, okay? Great. So in this left ear right here, I see that there's no discharge outside, no perforation. I see the eardrum is not bulging, right? It's not red. There's no redness noted inside, no bulging. I see the internal structures. I see the shining light, for this left eye is actually at the 7 o'clock, the shining light spot. I see the handle of malice, right? I see the jaw bone, and I do not see any perforation in there. I do not see any discharge, right? And so what I'm gonna do is I'm gonna move to the next one, okay? To the next ear. Please change the position a little bit. Thank you. So like we did the first one, I'm going to first inspect, your ear, to look for any type of, rash or keloids, or cyst or inflammation or injury or scars, which I do not see any. And, I'm also going to palpate, the pinna, right? Just to feel, the structure a little bit. I'm going to pull up. I'm going to pull up and down. Do you feel any pain?
No.
I'm going to feel the tragus. Do you feel any pain?
No.
And I'm gonna also palpate, the posterior auricular. Right? Do you feel any tenderness?
No.
Okay, great. So, I'm gonna check the external ear canal for any type of discharge, which I don't see any discharge. And now I'm gonna move into looking at inside your ears, all right? So what I'm gonna do is I'm gonna pull back and up, right? Great. In this right ear also I can see, there's no, I see the eardrum is like you know um um pale gray, right? It's kind of grayish color. It's a normal, color. There's no redness inside. There's no inflammation, no swelling, no discharge. I do not see any bulging of the, tympanic membrane, and I see that the main structures like the shining light is more at the um this is your right ear, right? Your right ear. This one is more like at 5 o'clock, the shining lights. And then I see the handle of malice, and I see other structures like the what you call this, the ombone, right? So, as far as the nose, I do not see anything. You can be more comfortable again. Get back to the regular position. So now, we did the head, the eyes, the nose, the ears. Now we're gonna move to the next step. We're gonna do the mouth now. First, I'm gonna inspect your mouth. I'm gonna inspect your lips, right? Just to check for any cracks, any cyanosis or discoloration, or swelling or sores. Now that I don't see anything, can you please, smile for me? Oh, my patient got a very nice smile. Let me see the gum. I got my gloves on. Let me see. I'm gonna shine the light. The gum is pink. Let me see down. This is great. Alright, stick your tongue out. This is great. Move your tongue up. Great. I see your salivary gland. Let me see. Open your mouth. I see your palate. Alright. Stick your tongue down a little bit. Say ah.
Ah.
Use my tongue blades. Say ah. Great. I see that your internal structure, like the mucosal lining of the mouth, is kind of pinkish, right? I don't see no lesions in there, no sores. I see that your teeth are great. You do not have any cavities. The gum, is pinkish, right? And there's no discoloration, there's no swelling, and you do not have any cavities, and your tongue movement is not restricted. Your salivary glands are patent, and your tongue is. Can you move your tongue up and down for me? Touch your palate, touch your cheek, your tongue with your cheek. The other side, great. And the tongue muscles. Stick your tongue one more time. I see the papilla. There's no glossitis here, and I see the papilla is normal. The size of the tongue is normal, and it's symmetrical. You're able to move your tongue left and right, and the mucosal lining is great. The uvula moves ups and down when you say ah, and the tonsils are present, and they're able to rise as you say the word ah, right? And no redness, no swelling, no inflammation noted. So sit down comfortably, please. The next step we're going to do, we are going to examine your neck. All right, pretty much is going to be the last step. So first thing we're going to do, we're going to inspect your neck first, to look for any discoloration, any rashes, any scars, any surgeries, and we do not see anything abnormal as far as your neck. So next thing I'm gonna do is I'm gonna palpate your lymph nodes around your neck area, and what I'm gonna do is I'm gonna start with the pre-auricular lymph nodes right here, and then I'm gonna go to the post-auricular, and then I'm gonna go to the occipital lymph node, and then I'm gonna go to the posterior cervical lymph node, and then I'm gonna come back to the anterior cervical lymph node, and then I'm gonna come back to the submandibular lymph node, and then I will do the submental lymph node, and then I'll come back down here to check for the supraclavicular lymph node. And then I'm going to check the infraclavicular lymph node. And then on this side, I'm going to check the supraclavicular lymph node. And then I'm going to check the inferior clavicular lymph node.